Okay, so yesterday we left off at third opinion. Well, just to give a quick recap. 29 years old, find a lump. Follow up with mammograms and ultrasounds, etc. since that time. 2015, November, I have a mammogram that is abnormal. Not just, hey, it's a little area of concern, but actually abnormal compared to 2014's mammogram. My own breast compared to my own breast. Okay. Then I got an MRI, and unbeknownst to me, I was diagnosed BRCA5. Then I got an ultrasound and was sent for biopsy. I got an ultrasound-guided biopsy, and that came back benign with typical hyperplasia. From that point, I go to the surgeon anyway because they want to do a lumpectomy. When I get to the surgeon, I'm really disappointed in the whole process because at this point I feel like I've stayed patient, but the only lump that I know of in my body is the lump that I've known since 1998. And the fact that the mammogram came back abnormal wasn't convincing enough for me because I usually get 2D mammograms, and this time I got a 3D mammogram. So I thought, oh, it's just a better mammogram. Cool, we got a better look at the same cyst I've had since 1998. So when the guy asked to do a lumpectomy, I was like, no. And that's when I got the second opinion and switched to another doctor. That radiologist was amazing. She explained to me a lot about comparing 2014 to 2015 mammogram, why she had concerns, why she thought the original clip placement and biopsy were done from the wrong area, and she did an ultrasound-guided biopsy. When it came back benign, she was actually disappointed. I thoroughly confused, but I knew your breasts were dense, so I guess that's why. Then we did the mammogram-guided biopsy. She also did that, and again, benign. Then, still under the guidance of this radiologist, but at an outsourced place, I went and got MRI-guided biopsy, which was the last possible biopsy, and benign with PASH. And again, PASH is pseudoangioma stromal hyperplasia, which is another form of hyperplasia that can create tumors in your body, but is not cancerous. I figure we found the abnormality, right? You said my breasts were abnormal. You said there was an abnormality back towards the ribs. You found it in this last biopsy, and you said the MRI guided biopsy was going to be the best one. So now that you have gotten the spot out of my breast that you've discovered, you said you're going to keep digging until you found an abnormality. Now you found an abnormality. Why are we not done, right? It's PASH. Cool. I'll see you again in 6 months and we can take this ride again. And instead they say we'd like to do a lumpectomy and of that spot. And they can't really clearly define for me where they're going to take the lumpectomy from. And I'm uncomfortable with taking it from 4 clips that are from benign areas of my breast. So you don't know for sure that any of those clips is actually near the cancer. One thing the pathologist said was, if you're even a millimeter off, you're still off. You're not going to pick up the cancer. It's not going to be in the pathology. So I do get that. But now the 4 clips are arrayed around the bottom quadrant of my breast. And I'm not comfortable with the willy-nilly guessing that it sounds like they're doing when they want to cut into me. So now we've come to we're going to do the tumor board. We're going to send you to a tumor board, and everybody's going to decide together. We all going to just do this really great thing. Okay. So these 4 different specialties come together. Radiologist, oncologist, pathologist, and the surgeon who's going to have to cut into me, right? They all get together and they've said, we still think you should do a lumpectomy. I don't know who decided or how they decided, but the surgeon was the one who broke the news to me. We're going to cut this 4.5 centimeter sphere out of your body. And my issue is not being cut on. I'm not afraid of surgery in general. I just don't want to be... I feel like this. If my choices are... And this is what I told the surgeon. Choice 1, We cut into you again. We cut a piece out of your breast that's going to permanently deform your breast. You're literally going to be... I love how she said the phrase, the architecture of your breast will be different, markedly different than your other breast. First off, architecture, are you serious? Secondly, no shit. You're taking most of my breast. It's not architecture anymore. You're leaving behind scraps. But okay, I digress. So she says, I tell her, option A, you cut into my breast and you take a lump, a sizable lump, out of my breast, and I'm forever deformed. If you come back to me after you've taken that lump out of my breast and you go, yay, you don't have cancer, I'm gonna be mad. I'm gonna resent you for the rest of my life because my boob is messed up bad for the rest of my life. On some, well, we just really wanted to be sure. We wanted to really be sure because of your family history. Okay. Or B, you take the lump out of me. My breast is permanently deformed. I go through some healing and dealing with that while I wait for pathology. And when it comes back, you go, oh, sorry, it's cancer. We're going to have to go ahead and do the mastectomy anyway. I'm willing and ready and able to do the mastectomy. I'm young enough that I can survive the surgery pretty well. Why would you go through this process and put me through surgery twice? And she goes, there's a third option. The third option is that if I take enough, when I actually cut the lumpectomy out of you, if I take enough of you, I'll get clear margins and we won't have to do the mastectomy. So it could be cancer and you won't have to do the mastectomy. So I'll be permanently disfigured and you won't do the mastectomy. So I will have cancer. My problem with your option 3 is A, the phrase, if I take enough, gives me an idea what you're going to do when you're inside my breast. You're going to cut me open and get in there and go hog wild. I mean, I'm going to take a generous portion, otherwise known as a 80% of a mastectomy. No, absolutely not. You're not going to do if I take enough method. But that method means you're going to be aggressive when you get inside there. Side note, I haven't even mentioned the best part of having a lumpectomy, which a lot of people don't talk about, and certainly I didn't know, except that I'm the same woman that you see here on video, same woman who goes to the doctor, same attitude. I ask a lot of questions, and I want to know what ifs and what fors and all that. So I said, what about radiation? If you do the lumpectomy, what happens with radiation? During this process, other things were happening. So I had already been to a surgeon, as I mentioned. I also went to a plastic surgeon. I did some research on breast reconstruction. Can I pause you for a second? Well, at least she's protecting me. Okay, so if you do the lumpectomy, will you have to do radiation? And she's like, well, yeah, we have to treat the rest of the breast. So while I had been going through these other appointments, all of these things are happening in concurrence with each other. So I'm also doing genetic testing and counseling. Believe it or not, there's a phrase of genetic counseling that has nothing to do with therapy. So genetic testing and counseling is happening. I'm also seeking out information from surgeons and plastic surgeons, and I reached out to breast cancer discussion boards, right? So I'm doing a lot of my own research because I'm so thoroughly frustrated. So I said, what if you do the lumpectomy? Aren't you going to have to do radiation? She says, yes. And I say, okay. So let me just tell you what the plastic surgeon said to me. If you ever do radiation on my breast, and then I ever have to get a mastectomy in the future, ever, the likelihood that I'll be able to hold an implant is far less chance than if I've never had radiation. Your cells are permanently changed, and your blood cells won't grow back right, and your pec muscle is different and has less elasticity, etc., etc. So it's like you have a 5 to 25% chance of not being able to hold an implant if you're a regular Joe who's never had radiation. And if you've ever had radiation, it's like 60 to 80% chance. Sorry, no implants for you, because your body cannot recuperate. And so don't hold me to those figures, but it is some variation of, maybe it's 40 to 80%. Whatever the percentage is irrelevant. It goes up exponentially. If you ever had radiation, you're probably not going to be able to get implants in the future. So I ask about that. Are you going to have to give me radiation? Yes, I will. Okay. So I'm 47, and you're going to keep on doing, even after, let's go with your option. I get a lump taken out of my breast, and then we do radiation. And then we go back and we do mammograms and ultrasounds on my breast, like we've been doing since 1998. And then I end up with, oh, sorry, you have ductal carcinoma, like your mom, and we're going to have to go ahead and do a mastectomy. Oh, you've had radiation? Sorry for you. You just go ahead and have no breast for the rest of your life. I just don't understand why that would be an option. I don't like those options. So I said, I am willing to do a mastectomy. If you are this concerned that you're willing to take out almost half my breast for this lump that is so concerning, that might just be PASH, if you're willing to go that far, to take almost my entire breast anyway, you're already going to cut me up. You're already going to deform me. You're already going to have me open. Why not just do the mastectomy? And let's just quit this. I can stop doing the mammograms. I can stop doing the ultrasounds. We can stop being concerned about it. Oh, I forgot. In addition to the radiation, another problem is that once you've had a lumpectomy, every woman's breast scars differently. I'm talking about internal scars that are not going to be on the skin. When I'm talking about the little finger-sized titty dimple I was crying over yesterday that I'm now beyond, I'm talking about inside your body, what shows up on mammograms and ultrasounds in the future. Scar tissue shows up. And because scar tissue is related more to the cuts and what the doctor did when they got inside you, it can look like speculation. It can look like areas of high concern. It can give you a BRCA 5 in the future. So if I do the lumpectomy, I am still signing up for more biopsies and more possible lumpectomies. And we might be doing biopsies and lumpectomies on scar tissue. I'm 47. I don't know if I mentioned 47. I don't want to do this for my next 40 years. And I do plan on living 40 years. I got a ways to go. I don't want to keep doing this. That's 40 more mammograms, 40 more possible ultrasounds. Like, no, thank you. So I asked for the mastectomy, and she said, no, we've come to an impasse. I'm not doing that. That's not the standard of care. It was actually her words. My words are, I'm not doing that. But she said, that's not the standard of care in this scenario. And to her defense as well, by this time, so in 2006, I was tested BRCA negative. My mother was BRCA negative. My grandmother was BRCA negative. We all have a weird abnormality at R7C. I don't even know what that means, but we have a genetic mutation at that spot. But it still leaves us BRCA negative. And then since then, I also had 7 more genetic tests done this year, all normal. So for all genetic intents and purposes, I am no more likely to have cancer than the next guy or girl. The next girl, since this group puts me at the highest risk, right? Unfortunately, but because of my direct linear heritage to breast cancer with my mother and my grandmother and the other cancers that are in my family, the genetic counselor said I am 56% likelihood, empiric likelihood that I will have breast cancer in my lifetime. So if this isn't cancer, it might be cancer in the future. And so I've come to this place where I feel like I need to make a decision. And I feel like I'm ready. I'm ready. I'm in my head, I'm ready. Emotionally, I'm not ready. I don't want to do this. But that's what you guys are for. That's what I'm doing here. I suspect that I'm probably not the only one who's considered a mastectomy and didn't feel ready.